my most correct from an epidemiological and statistics answer is that it's not really the number of cases among IDUs that's decreasing. It's the graph that you see is a proportion of reported cases. So as the number of cases among sexual transmission goes up, proportionally the proportion of IDUs goes down as well. So it's not an absolute number in that sense. I hope that helps. Thank you.
Okay, thank you, Dr. Corina Rosali. Prof. Samsu, you have two questions from Kuala Lumpur.
Okay, about health education. Our government starting the health education from junior high school formally, but now we consider that in some study it stated that sexual activity is starting at the younger age. So there are some opinion that health education should be started earlier than junior high school. And actually some NGO already started health education for elementary school age students, especially by comics or other things, which is emphasis on the knowledge of transmissions and how to prevent HIV infections. For condom use, besides the quality is important, but also the most important one is the consistency to use the condom, because transmission of HIV could only prevent by consistent use of condom. Not only because of the quality, but if they are not used consistently, the infection could be occur. About the evaluation of the treatment, in some university we try to evaluate whether the clinical failure or the virological failure. In my hospital, there is a study that said that the virological failure is 8.6% among the people living with HIV using antiretroviral consistently in 6 months. So the result is actually good one, but how to maintain the adherence? So this is one of the problem, because adherence is not only depend on people living with HIV, but it also depends on us, health provider, and also the government as the management to make the antiretroviral available for everybody.
Thank you, Prof. Samsu. We move from to Bangkok. Is Bangkok with us? No, okay. The Philippine side at Reginet, do you have questions for the 4 speakers?
Yes, thank you. From the Indonesia, could you talk some more regarding the issue on circumcision as a biological prevention? Do you have actual program which promotes circumcision as a preventive measure? And also for Malaysia, regarding the rate of, do you have figure as to the positivity rate of HIV amongst antenatal attendees? Thank you.
Okay, before we give it, let me also invite University UI at Salemba. Do you have questions for the 4 speakers? UI Salemba?
Yes, I have a question. My name is Taufik. The question is for Mrs. Karina from Malaysia. You've told us about the active screening is for Muslim premarital. So the question is in your country it's just only for Muslim premarital test, HIV test before the Muslim married, or all the region? So the second question is the Muslim premarital test is free? I mean, is from the government, is already paid yeah, for everybody Muslim from pre-married test HIV. Okay, that's the question. Thank you.
Thank you. You at Depok side, do you have questions for the four speakers?
Yeah, I have
Depok
question.
side. Okay.
Yeah, hello.
Yes. Yeah. Yes, you can.
Can you hear me?
Yes, loud and clear, please.
Okay. I have question for Timor-Leste. From the slide, I saw that the government of Timor-Leste decided that HIV-AIDS is not the high priority project for the government. And my question is why the government Timor-Leste decided, and when the Timor-Leste have to decide that HIV/AIDS is going to be the high priority, because as we see from the prevalence, 94, if I'm not mistaken, 94 prevalence of HIV is, I think it is more, it is going to be better if the high priority is doing on the less prevalence. Okay, thank you.
Okay, now I give the opportunity for Timor-Leste to respond to the questions. Dr. Agustin?
Okay, Timor-Leste has considered HIV/AIDS as a priority, but not as high as other priority that they have. And you have to consider that Timor-Leste, there is it is a new country, and it is a least developed country. They have other priorities like infrastructure, for example. And in the National Development Plan, they do not consider HIV/AIDS as the highest priority, because of their other topics that needs to be addressed immediately. And you see, until now, the prevalence is 0.17%. It is very low compared to the UN standard. But like I said, in the last quarter, we have seen that there is 30 new cases coming in Timor-Leste. It means that they need to do more effort in order to address that issue. And I particularly agree with you on that, because it is still a low prevalence country. It does not mean that you need to close your eyes and sleep. It is when it is a low prevalence country, you need to double your effort in order to prevent that Timor-Leste become a generalized epidemic country. Because I always say to them, let us consider like the example of Papua New Guinea, not far from Timor-Leste. Papua New Guinea was having exactly the same low prevalence, but in less than 10 years had been transformed to a generalized epidemic country. And this, when telling them those kind of issues, those kind of data, and this trigger something inside the government. And I can tell you that sometimes you need people in the leadership to make things happen, and sometimes you need momentum. And I think that the momentum has arrived in Timor-Leste through that here, because we have seen that very senior official people taking the lead on that, because of the fact that we have senior leaders in Timor-Leste who have been infected by HIV/AIDS. And it could appear as an opportunity to change the perception. Thank you.
Thank you, Dr. Agustin. Dr. Razali, you have two questions, one on INC testing and the other one on premarital testing.
Okay, thank you for the questions. Okay, thank you. Regarding HIV prevalence among women who attend antenatal clinics screened, latest data put it at about prevalence of 0.04 to 0.05%. So we can take this pretty much as a proxy of the prevalence of HIV in the general population. And this fits into how Malaysia is defined as a concentrated HIV epidemic, where the prevalence in the general population is low, but is high among certain subgroups of population, namely IDUs with 20%. excuse me. Regarding premarital HIV testing, yes, it is currently only mandatory for Muslim couples getting married. And the cost of testing and counseling is at the moment borne by the government, so it is free, yes. Thank you.
Thank you, Prof. Samsu. You have, I think, one question on circumcision.
Yeah, actually the circumcision is a very common practice in Indonesia. But we have now a little bit problem because the cost for circumcision is high, and some family cannot afford that. It's around more than 500,000, so more than $50 US. So a lot of charity organization doing what we call muscle circumcision. It means that 100 to 150 children were circumcised at the same time for free. But as a profession, we also very aware of this because the muscle surgery could be also not as good as the individual one, because a chance, a risk of infection could be there. So the culture, the religion for male circumcision is there. It's a very common practice, but in some family there will be a problem to access that because of the cost. We don't know whether our government could subsidize this, because this actually one kind of prevention.
Okay, thank you. I think we have given the opportunity for all sides to ask questions. I would like to invite if the speakers have additional comment or probably questions, so you can discuss between the four speakers.
Can I ask our
yes.
colleague from Philippines?
Okay, yes. I will chant from Prof.
Yeah, I want to know the role of medical professions in its control program in Philippines, because in Indonesia mostly it's the role of government, NGO, and international agency. How about situation in Philippines?
Okay, Dr. Avelino, the question is, what is the role of the medical professions in HIV/AIDS prevention?
Thank you very much. We are the Philippine National AIDS Council, as what I have mentioned. It's composed of government as well as the private sector, and one of the members of the council is from the Philippine Hospital Association. Also, we are also having a member from the medical association or health professional groups, which in itself is a non-government organization. With regards to concrete activities at the hospital or the clinics, we have organized an HIV/AIDS core team. This is composed of medical personnel based in the hospitals. The composition are doctors, nurses, and medtech, together with a social worker who provides services to HIV positive who comes to the hospital. And just recently, 2 years back, the Philippine government has organized 11 treatment hubs, which are also based in the nationally retained hospitals all over the country. Thank you.
Okay, maraming salamat po. Dr. Do you have any additional comment or question for the other three speakers?
Yes, I have one question for the Philippines. I would like to add, to tell him that what is the role of the church, because I know that Philippines is a Catholic country, like Timor-Leste. So what is the role of how the HIV/AIDS program are seen by the church, and if there is a good example, how we can in Timor-Leste benefit of their experience? And second question
Dr.
for him is, he said that there is a workplace policy in place in the Philippines. This is very good, but I would like to know how it works in the reality.
Please, Dr. Avelino.
Thank you very much. The first question is very interesting. Actually, when we initiated or we started with the program on HIV with the Roman Catholic Church, we were quite unsure if we will be taken in or not. Fortunately, after lots of consultations and meetings with the church authority, we were able to explain to them how their role in providing support to PL-HIV is very crucial with regards to the response of the country as a holistic approach to HIV. So what we have done is to really formulate a training module specifically for religious, and this training module capitalizes on the importance of promoting abstinence and mutual monogamy. Condom is also mentioned, but not as pronounced as in other intervention activities, which they themselves can promote. So currently, what we're doing now is train religious organization as well as religious institution on how they could engage in promoting as well as providing emotional as well as spiritual support to PL-HIV. Now, with regards to the workplace policy, this is under the Department of Labor and Employment, wherein big companies are being encouraged to come up with a workplace policy wherein issues pertaining to the provision of education campaigns in the workplace is being emphasized, as well as the provision of services like sexually transmitted infection services. VCT is also encouraged to be implemented or being carried out in the company clinics or in the clinics where employees would rather go for examination. And one good example that we are doing also related to employment is the program that we're having or providing for migrant workers. We do give pre-departure orientation seminar. And in this pre-departure orientation seminar, HIV-AIDS prevention measures are being discussed to potential migrant workers. Thank you.
Okay, thank you. Dr. Karina Rosali, do you have additional comment or questions?
Just to pick up on that point from Philippines, in terms of the pre-departure training for HIV, does that include HIV screening as well? Do you look for HIV prevalence? And what about upon returning from countries of work? Thank you.
Dr. Avelino.
What we underscore in our pre-departure orientation seminar is primarily it's basic information on what's HIV and AIDS. The law of the Philippines promote voluntary testing for HIV and AIDS. Hence, we don't advocate mandatory. Our migrant workers are being tested upon the request of the country who will be accepting them and where they will be working. So if the country would require them to undergo testing, then that's the policy of the receiving country. Now, with regards to their coming back to the Philippines, what we do is we strengthen our VCT program as well as our provider-initiated voluntary counseling and testing, because also again because of the law, which prohibits us from doing mandatory testing. I hope I did answer the question.
Okay, thank you. Timor-Leste, Dr. Mario Agustin, do you have additional comment or questions?
Yes, I have one question for Malaysia. In her presentation, she said that the fishermen are at risk of contracting HIV because of the fact that they are IDU. Most of them, some of them are IDU. So I would like to know what are the factors that explain fishermen be at risk to get HIV. And also, we have another question from my student. Yeah.
Okay, thank you. Here, I'd like to raise a question to the Indonesian as well, the professor. As you have been presented through your presentation, you have said that within the national capacity, that is 70% of fund is still from foreign. And then I'd like to link with the challenge that you have said that the lab test is not free. And then you have said in the diagram that in 2010 you'll minimize the number of reports, especially for HIV to 600. So could you provide the more explanation regarding that?
Okay.
And then we have another question from the...
I'm afraid we are running out of time. Yes?
Shall I answer first?
Can you allow us to
sorry.
ask one more question?
Okay. Let me give Dr. Ajali the opportunity to respond to the question first. Karina.
Okay. Regarding the fishermen, I must say the current information that we have is still very much anecdotal and by observation. So these are not actual full data collected yet. It looks like there seems to be high risk and high prevalence among them, and which is why now we are starting to do more in-depth research to look at the actual risk and prevalence. But potential risk factors included would be a high rate of injecting and sharing of injecting, because in addition to that, these are those in a rural setting, so knowledge about HIV and HIV risk transmission tend to be quite low. And because of the occupational risk hazards, it's high risk and high testosterone, and peer pressure is also very high among the fishermen network. So once the injecting drug use risk is embedded in the community, the uptake among the network tend to be quite high. We also think there is some sexual risk as well in terms of transmission to wives and other sexual partners, because there is also, again, some anecdotal indications that there are unsafe sexual practices with non-marital partners, with non-spouses going on within the community. So at the moment I can't answer for certain, but that is definitely one of the research areas we are looking at now. Thank you.
Okay, thank you, Prof. Samsu.
Yeah, I think we need collaboration with our friend from another country to control HIV/AIDS in Indonesia. But high dependency to foreign funds will become a problem. So that's why there is some opinion now in Indonesia that our government should increase the fund for HIV/AIDS control, so we not only depend on the foreign aids, but also the national funds should be increased to this kind of control program.
Okay, I believe Timor-Leste, you still have one question, and this will be the last questions. Timor-Leste, please. Hello?
Okay, thank you. I have a question raised to Malaysia. As you said that you have a program which is called Healthy Without AIDS. So I would like to ask, what is this program all about, and how much this program has helped young people to live healthy without AIDS? Thank you.
Okay, Dr. Karina Razali, please.
The Healthy Without AIDS program, or we call it ProStar, is targeted at school children, secondary school children, and it is a government initiative. I must say it has lost its initial enthusiasm. It was very active in the 90s, started to slow down a little bit now, but what it entails is empowerment of the youth, awareness of HIV and its risk, and in terms of encouraging safe behavior, and so it does have the sexual health education component in it as well. It is voluntary based, it's not imposed onto the students, so they function more like clubs around schools settings. Anecdotal reports that I have heard is that not many of them are currently very active, and there is not good monitoring and evaluation of the impact of the program onto awareness. So that's also another thing that we are pushing for, to have better monitoring to see whether this has any good impact and whether it can be revived if it does have good impact. So I take that more of a comment rather than a question, because I can't really answer. Thank you.
Okay, thank you. I think with this question we will conclude the panel discussions. Thank you for all the speakers and also for all sides that joined us today. I would like to remind you to fill in, I think for the sites in UE, to fill in the daily evaluation form. And next Thursday is a national religious holiday in the country, and Ascension of the Jesus Christ. And we will not have any video conference next week. We will resume the video conference on the May 28th. Okay, thank you very much. You have a nice day.
Thank you.
Moderasi saja, karena banyak teman-teman di sini yang punya banyak pengalaman atau lebih tahu, jadi kita bisa saling sharing informasi. Ada hal-hal yang mau diangkat, mau di sharing atau mau ditanyakan? Silakan.
Please mute.
Pak Gatot. Ini
Yes,
dengan
Pak Vicente. Ya, Pak Vicente, please.
Ini cuma input aja. Tadi di sini suaranya agak kurang bagus. Kadang agak hilang gitu. Kadang suaranya baru bagus. Nggak tahu masalah teknisnya apa tuh. Tapi ini input aja gitu.
Oke, ya saya sama. Kami juga terima suara dari Timor Leste agak naik turun, Pak.
Mungkin saya akan coba dengan di Tokyo supaya kita cari tahu masalah apa.
Oke, Oke, kita bisa koordinasi dengan TDLC. Thank you. See you.
Masih ada hal-hal yang ingin kita diskusikan bersama di sini, silakan kalau dari teman-teman masih ada. Oke, kalau tidak ada ya kita tutup sampai di sini acara hari ini, dan sampai ketemu tanggal 28 karena minggu depan adalah libur ya. Terima kasih.